Welcome back. We are answering your questions about the coronavirus with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. Remember, you can text your questions. The number is at the bottom of your screen. This text asks, where are the testing sites in the triad, and can you get tested without having symptoms?
Sure. So in terms of getting tested with or without symptoms, there's definitely it makes sense for it to get tested, especially if you feel like you've been at risk or you've been exposed, and it doesn't necessarily require you to be symptomatic. And even some of the test sites don't necessarily require you to have a doctor's order, so you can drive up and get tested. I know if you look at the Cone Health website, some of the test sites are listed, as well as there's some community outreach sites during the week. And there's a drive-through site, I believe at our old women's hospital that's off the Green Valley Road. And there are probably other sites associated with other medical facilities as well throughout the triad.
I'm working on a web story for folks at home right now about how the easiest place to find a COVID testing site. So that'll be up in just about 20 minutes or so, and that will definitely help you at home for those of you who texted in about that. This next question is, could someone get the flu and coronavirus at the same time?
We do have cases of folks having both infections at the early onset of the pandemic back in March. It is difficult to estimate how prevalent that will happen. I believe, again, kind of going back to the basics of wearing a mask, getting vaccinated, using hand hygiene, those are huge ways of preventing getting flu, as well as at least wearing the mask and hand hygiene to preventing COVID-19. So what we're hoping is that really embracing those interventions in order to minimize the risk of getting both.
This text says, should I postpone my dentist appointment for Friday? I'm a little leery of being in a small space.
So I would ask your dentist what they've done in order to accommodate for COVID-19. I know I just took my kids to the dentist appointment, and I too was worried about what the scenario would be, but I know a lot of dental offices have really decreased the amount of patients and in their offices, and created that distancing, as well as screening people for symptoms. So, I believe it is pretty safe, but it would make sense to give them a call to see what they've done to accommodate for that.
Right, and they should be very willing to tell you all of the different things that they are doing to keep you safe. And if you don't feel comfortable, you don't feel comfortable. This person is saying, if you've had COVID once, is it possible to get COVID again if it's been since June?
So the thought is that once you have COVID-19, you probably have enough immunity to last you for 3 months. Potentially, could it be longer? That could be the case. However, we feel that we've heard of some folks having some reinfection after 3 months. So the guidance that's come from the CDC is that if you've had COVID in June and recovered and doing well, you would not necessarily get retested. But however, if you started having symptoms again of like a respiratory illness in October, we would not only test you for flu and some other respiratory illnesses, but we would also consider COVID as being part of that presentation.
There's a text question here. It kind of follows up on part of the COVID story that we did at 5 o'clock, and it says, is there a concern that rapid COVID tests aren't as accurate as normal tests because they're not as sensitive?
So the rapid tests, the ones that come back like in 15, 20 minutes, is a different, it's an antigen test. And they have a decreased sensitivity than the other test that takes like a couple hours to turn around, or even a couple days, which is a PCR test. The thought is, if somebody is symptomatic, it should probably be able to pick that up. There is thought that with those antigen tests, if you still are having symptoms a couple days later and the first test was negative, it's worth testing again. So there are some applications of when it's it makes sense to do antigen testing versus maybe for screening. But if you're sick enough to present yourself to the emergency room, there's a good chance they'll be giving you the PCR test.
The one that is much more sensitive.
Correct.
Okay. All right. Great. Thank you so much for your time and your expertise. We so appreciate it. We learned something, and things change every single week, it seems. So it's good to stay on top of it. Thank you for joining us today and for your text questions.